Hi everyone, I am Holly. I am here with you today to talk about pregnancy options in your maternity care. So what happens once you find out you're pregnant? There's two lines on that stick looking back at you and you think, oh my goodness, what do I do now? So I am a midwife. I've been a midwife for coming up a decade in a couple of months. And I love it. It's just absolutely everything that I just feel so privileged to be a part of. We are going to be going through this little here we go. So we're going to be going through this PowerPoint today, this presentation. And of course, this will be recorded so that you can refer back to it later, or you can send people my way so that you can explain with them or just show them, or if they're pregnant and they're trying to figure out what to do next. So please don't feel shy to interrupt me. If you have any questions, pop them up. I'll answer them as we go through. There should also be some time for questions at the end, which would be lovely. This is me. Hi. So I'm a nurse and a midwife. I majority have worked in rural Western Australia, but I have also previously and currently work in Metro. I also had a little stint out in outback Queensland, which was super fun. But WA is where my family is, so here I am. I saw heaps and heaps of parents struggling with the transition that comes with having a baby, whether it's your first one or your 10th, it's still a really big transition. So I set up the family room just to support this time of life. I did some extra training. I'm a qualified hypnotherapist and NLP master. So think about mindset, removing fears, and changing or undoing the things that keep getting in the way of you achieving what you want out of life. And that's what I can do. So what happens once you realise you're pregnant? What do you do and who do you go to? For most of us, it'll be, you tell your partner, you might tell your mum, your best friend, your sister, but for them, their lived experience is the only one that they know. So they might not know where to go, who to talk to. It's very exciting to celebrate and share that amazing news with your nearest and dearest. But for most of us, we'll also choose to go see a medical professional. So this is what we're going to go through today. Now, this is a very busy page, but this is basically the healthcare system in a nutshell. So at the top, you suspect you're pregnant, maybe you've done a home test. Usually you make an appointment at a medical centre to see a GP. Some people will know that they have a midwife in the community or at the hospital, and then they can contact them directly. But for most people, they'll end up at the GP, and that's a totally reasonable thing to do. GPs are perfectly placed to do all your screening, have a little discussion with you, send you for scans, make sure that you're as well as can be, and starting any supplements or vitamins or anything that you might need at the start of your pregnancy. And then from there, your GP will usually ask, do you have private health or do you not? Where would you like to have your baby? And then maybe they'll look at your postcode. And I know this is how it works in Western Australia. It can potentially work differently in other states, although what I'm familiar with is the postcode system, which does translate to other states as well. So looking at your postcode and seeing, okay, well, you're in the catchment for this hospital. So if you've got private, you get to choose. You get to choose an obstetrician, you get to choose which hospital you attend. If you're on public, so you have a Medicare card, you have different options in all of these. There are also other models of care. So starting at the far left, public system. So providing you have a Medicare card, this is all free. So you can see your GP until you're 20 weeks. They need to have done extra training for them to have the knowledge to provide care past 20 weeks pregnancy. So they will refer you to someone before then, so that you get to start seeing them from 20 weeks. So your GP is usually where you start. There's also the choice of hospital antenatal clinic, a midwifery group practice, which is usually linked up to a hospital, and a community midwifery program, which again is usually government or hospital based, but they have different options in terms of where you get to birth. So if you're going through the hospital clinic, then you're just going to birth in hospital. This also goes for all high risk pregnancies, whether you're at Armidale, King Eddie's or Joondalup. You might see different people in your clinic depending on what's going on in your pregnancy. And then with the midwifery group practice and community midwifery program, there's choices of where to birth depending where they work, what environment they work. In the private system, so you've got private health with pregnancy cover, you choose an obstetrician, and sometimes you'll choose your hospital first and then your obstetrician that births there, or you'll choose your obstetrician first and know that they just birth at whatever hospital and you'll just go there. In which case you birth at that private hospital. Other models of care are choosing a doula, which is an additional kind of like an accessory to your pregnancy care, a very important one if you're going to use her. Privately practicing midwives, who are similar to obstetricians in that they are autonomous and provide a private approach to your pregnancy, but not at all the same in terms of their training and how they go about that. And then there's private pregnancy clinics and shared care. So we're going to go through all of this, and hopefully by the end of it, you actually understand what I'm talking about when you look back at this. Public versus private. This is often the first, I guess, barrier that people come up against, because you feel like, well, I've got private health, so like I should use it. And, if I'm paying for it, then it obviously means it's better. And you'll be able to talk to lots of different people and figure out that maybe that's true and maybe that's not, and it could be different for everybody. So the public system, it's free with a Medicare card. 3/4 of births in Australia happen in public hospitals. They are set up for large numbers of births. It's a comprehensive pregnancy, birth, baby and postnatal care system. You usually stay up to 3 days after you have your baby if everything is going well. They have a home visiting service once you're home, and they have specialists available if needed. Sometimes if you start in the hospital in your catchment and something happens in your pregnancy, there's some risk factors that arise, you might then be referred on to the next public hospital, that has more specialists that are what you need. But that happens very easily. That's not anything that you have to do yourself. And then in the private system, there are birth and hospital expenses that are covered by a private healthcare fund. The obstetrician appointments that you have in your pregnancy are usually not covered by your private healthcare fund, and Medicare will only cover a percentage. So you do pay out of pocket for your pregnancy checkups. Almost 1/4 of births in Australia happen in a private system. You must see an obstetrician or a GP obstetrician who has access and admitting rights to a hospital for birth at a private hospital. You usually will have a no-one doctor at your birth. You stay maybe up to 5 days after you have your baby if everything is well, and it's not appropriate for everyone. So some private hospitals are only set up to take patients that are reasonably normal or only have pregnancy concerns, pregnancy risk factors that arise. If there's any risk factors in your medical history or some really rare pregnancy risk factors that pop up, you will still be referred on to another hospital. The hospital with the most specialists and the most access to care in Western Australia is King Edward, very closely followed by Fiona Stanley. So depending on your location, the obstetrician, you might be referred on out of the private system. Okay, so we're just going to go one by one through all the different roles that you saw on that very busy chart. We're starting off with our GP, our general practitioner, a lovely doctor at that medical centre. Usually the first medical practitioner that most of us will go to confirm that we're pregnant. You usually go in, you say, I've weighed on a pregnancy test at home. It says I'm pregnant. I'm starting to feel it, like I'm feeling different in my body. What do I do now? And they go, great, like here's a wee test to do, or here's a blood test to get, here's a scan form. It kind of depends how pregnant you think you might be. They'll look at the date of your last period, and they'll kind of start you off with, all right, here's some diagnostic tests. Let's confirm 100% you're pregnant and your baby's in your uterus, and go from there. So they will discuss your pregnancy care options. They are licensed to provide care until 20 weeks only, unless they've done that extra training. And they send your pregnancy referral to your chosen care provider. So in WA, if you're going to a public hospital, or if you live in the country and you don't have access to a private hospital and you're just going to your local rural hospital, they just send your referral into the central referral services. And there's a whole system where all the referrals go to, and then from there they get sent out. Morning. And so these guys are the ones that send your referral to wherever you're choosing to have your baby. For a lot of us, we don't understand even what our options are up to this point. So trying to decide what birth you might want in terms of, where do I go for my care? What's going to be the best care model that will get me the birth that I want? That can sometimes inform your care provider that you choose. GPs are amazing at this initial care. They're not heavily involved in the birthing world or in maternity care, especially once it gets to working in hospitals and things. So unless they have previous experience in that, they're sometimes not able to answer all of your questions about it. And this is where you need to start doing your own research. Right, GP obstetricians, or GPOs. So this is a GP with obstetric training. So they are partway between a general practitioner and an obstetrician. Depending where they work, depending on their experience, they will know amazing things. They'll be fantastic doctors. The majority of them are like amazing, almost as good as obstetricians, just without that final training. And for some of them, a lot of them, it's a lifestyle choice or just what they prefer to do. So they provide care right through pregnancy, birth, and postnatal. They're often found in their own medical practices, working in hospitals or in private pregnancy clinics. If a high-risk pregnancy situation develops, they become part of the multidisciplinary team that assesses you and supports you and looks at your treatment and referrals. So they might not remain your primary care provider, but they're still usually involved in your care, which is really nice. Obstetricians. So obstetricians are specialists in pregnancy, in high-risk pregnancies especially. They're RANZCOG recognised and trained, RANZCOG being the Royal Australian and New Zealand College of Obstetricians and Gynecologists. Very long term. They understand pregnancy as something to be responded to be controlled. Some will treat it as high risk regardless of any true risk factors. So for a lot of people, especially if you jump on pregnancy forums and Facebook groups, you might, see people that had a perfectly normal pregnancy but just kept getting told things that they didn't quite feel was, right, or looking back, they go, oh, like, I didn't have a big baby and I didn't need a cesarean, and like it didn't just, work out the way that they said it would. And a lot of the time, obstetricians are used to seeing high-risk pregnancies, things where there's a really high potential for, like, poor outcomes or things just to go wrong in labour, birth, or afterwards. And so their normal is abnormal. So when you're used to high-risk pregnancies, you do tend to treat most pregnancies as that because that is your normal. Obviously, not all doctors, but they are also often the only doctors with referral access to private hospitals, as they have admitting rights. Some GP obstetricians do as well. But if you are going through the private system and you're choosing an obstetrician and you know that you're really healthy and you're low risk and you have a really normal pregnancy, keeping in mind that pregnancy is not a disease, it's something that is a natural part of our life cycle, then choosing an obstetrician who aligns with that belief is quite important for your outcome. So they work in a private continuity of care model, which means that you just see the same person again and again. So you often see the obstetrician for most of your appointments. Sometimes you might see their, the other obstetrician that they work with, because they often work in a small group or in a couple. And they'll often have a midwife or two that works in their rooms as well. So you often see the same people over and over again. They will often outsource to their clinic midwife or to the hospital that you're going to for birth for all your education needs during pregnancy. And that is something that I do hear a lot of, is that, they ask the obstetrician, as someone might ask the obstetrician a question like, oh, like, what are my chances of having like a really normal birth, or I really want a water birth, or I don't want an epidural? And the obstetrician will just be like, oh, yep, talk to the midwife. Like, their focus is just like, this is your checkup, we're going to have a baby on this date, and I'll see you there. And that can be quite unsettling sometimes, to have a doctor who doesn't engage with you as much as what you're requesting of them. So when you are looking for a care provider for your pregnancy, just be aware of that and make sure that you're getting the kind of person that you can relate with. Right, a midwife. So a midwife is a trained professional whose primary focus is to be with the woman. That is literally what midwife means, is with women. So midwives work across all spectrums of models of care, including the hospital, at home, in emergency pregnancy clinics, in antenatal clinics, in the nursery, etc. Midwives are experts in normal and low-risk pregnancy. They are able to recognise when risk factors pop up and work within that multidisciplinary team to, send you to the right person, to send you to a specialist, to do whatever needs to be done. They continue working with you regardless of risk in all settings to support your pregnancy, birth, and once you've had baby. They can also have had additional training as child health nurses, lactation consultants, nursery midwives, so many different kind of routes and ways to be a midwife. And these are the most common birth professionals in Australia, because there's way more of us. Okay, so those were all the professionals that are potentially going to be involved in your care. These are all the different kind of locations or like kind of other forms of working through your pregnancy. So your postcode will usually determine which hospital you were referred to. The first appointment is usually about 20 weeks. It does depend when your referral has been sent through to the hospital. And knowing that your GP is going to be providing care to about 20 weeks, the first appointment usually isn't booked until then anyway. Often the midwives and doctors will rotate through the clinic, so you might see new ones each visit or just the same few over and over again in your pregnancy. There's no guarantee that you'll have the same midwife every appointment. And some of the antenatal clinic midwives also work in birth suite or on the postnatal ward or in the assessment unit. So you might see a midwife at your clinic appointment, and then a couple of months later she might be your midwife for your birth, or it's nice to see people in different areas. Going through the hospital clinic, the majority of your appointments will be midwife appointments unless there is some risks happening in your pregnancy, in which case you might see doctors quite a lot as well. It can be a niche clinic as well, so thinking about your next birth after cesarean, if you've had a cesarean for your previous birth, if you're a young mum, if you've got gestational diabetes, if there's another risk factor. Midwives are always involved in pregnancy clinics and are the ones that kind of will give you education and do all your basic checks and, you know, make sure you're feeling okay. Often before you go see the doctor to discuss anything that needs to be discussed. Because they work in a hospital, in a hospital antenatal clinic, the referrals are quite easy to do because they're just referring to another section of the hospital. So you get to see the right person quite quickly. Going to antenatal clinic, you also end up getting familiar with your birthing hospital, which is good because it's nice to know, you know, where the good parking is and how to get into the hospital and, you know, how to walk to maternity ward or wherever you need to be. MGP, midwifery group practice. So this is a continuity of care model as well. So where you see the same person over and over again. This is in the public system and midwives work together in buddies or in teams. You are given a named midwife to be your midwife. So you see them for each appointment. This is sometimes at home or at hospital. They can order all your routine bloods and scans. They work alongside a public hospital. They're often based maybe within the hospital grounds. They know the system. They understand how it works there, so they can talk with you about that. And they also understand their referral system and, you know, where to go for classes and all those important things that you really need to know. So MGP midwives work within an on-call system for their birthing clients or their emergency presentations, especially those that are out of hours. So there'll often be midwives that, you know, you might be like, oh, but my midwife doesn't have any appointments this afternoon, like they're only doing a half day. That's a bit of a weird system, but then that midwife will likely be the one who's on call overnight, you know, for both their clients and their buddies' clients. So if anything comes up, if they get any phone calls, if someone goes into labour, they're the kind of first responder for that person. Approximately 80% likelihood that the midwife at birth will be your named midwife, which is really, really good. You don't get anything as high as that in any other model of care, except for one we'll go into in a minute. And you get home visits for checkups and care once you're home with baby. Depending on the hospital or like the location you're in, the home visits will last anywhere usually between a week to 6 weeks. Working in Metro Perth, we would do visits up to about 2 weeks. Working in Queensland would do visits up to 8 weeks. Working in rural WA recently, I was doing visits up to about 6 or 7 weeks. It kind of just depends where you work as to how long those visits go for. CMP is the Community Midwifery Program. So public continuity of care model in Perth Metro. So it's based, I think, out of King Edward Memorial Hospital. They do have kind of clinics over the metro area. They've got one down south, they've got one up in Joondalup, they've got one in, I think, Kalamunda. You're given a named midwife to be your midwife. It's very similar to an MGP, except they're not based in one hospital. They're spread across Perth. So you see them for each appointment, and that's usually at home. They work in small teams similar to an MGP, but they're able to travel out of their hospital catchment because they're not bound to one hospital. They're experts in low-risk birthing at home or in a birthing centre. They can also provide you hospital care if you are needed to transfer to a hospital, and they get to stay as your midwife. They're recognised in like government public hospitals as midwives with admitting rights. And then they provide home visits for checkups once baby is born. So if, for example, if you're looking to have like a really normal birth, especially, I guess, like the lowest intervention birth would most likely be a ward birth at home. The CMP is like the lead kind of model of care to give you that outcome. The next would probably be MGP for water birth, but some MGPs in WA do provide home birth as well. They do down in Bunbury. I think they do in a couple of other places. But when you start thinking about, okay, like I really want this type of birth, you then have to think, okay, like who's actually going to be able to support me for that? And that's these guys. Privately practicing midwives. So they work in a private continuity of care model. So they're not in the public system. They are covered by Medicare rebates though. So the Medicare rebates cover a significant amount of cost. There will often still be some out-of-pocket expense. It's not usually as much as seeing a private obstetrician, but you also get more options in terms of birth with a private midwife. So private midwives have their own midwifery business and are experts in providing holistic care to women. Some will have admitting rights to hospitals. So you could, imagine, okay, like I wouldn't mind birthing at home. That would be really cool. But if something changes, I know that my midwife also has admitting rights to my local hospital. So I still get to have her as my midwife regardless of where I birth, which is really nice to know. They do book out really quickly. There's not a lot of them in comparison to the women that want home birth services or private midwifery service. You do have to contact them really early in your pregnancy. I would recommend by 8 to 10 weeks pregnant. They only take maybe 3 or 4 due dates a month. And obviously they might book out, as far as 9 months in advance. So you need to get in touch and even maybe be chatting with them before you get pregnant, just to see, okay, like when I get pregnant, are you going to be the person that I feel is going to be right to look after me in my pregnancy and at my birth? And something to think about if you're not surprised by a pregnancy. So they are endorsed midwives, so they've had extra training. They can work independently. They have their own Medicare provider number and prescriber number. So they can write the scripts, they can order scans, they can order bloods off their own back. Most of them offer home birth, some with admitting rights to a public hospital as well. To my knowledge, no private midwives have admitting rights to private hospitals. So just be aware of that. Private pregnancy clinics. So this is a private continuity of care model. It is reasonably new to Perth. They often bulk bill all their appointments. So it runs like a public clinic, except it's owned by a non-government company. There's several in Perth. We're talking about Western Obstetrics, one for women, Perth Pregnancy Centre. There's GP obstetricians and midwives that work together to provide you with comprehensive care. If you attend for your appointments on the same day at each appointment, say a Wednesday, the midwives and the doctors working each week will have set days. So you'll see like the Wednesday midwife and the Wednesday doctor on your scheduled appointments, which means you do get to see the same people over and over again. And that's how it's a continuity of care model. They often also have lactation consultants, physios, immunisation clinics, mental health support, etc. So there can be like a bit of a one-stop shop for like pregnancy care and after-birth care. Often the GP obstetricians who work there are also linked to their closest hospital and will be on call for the clients that they have coming through that clinic. So there's like a decent chance that you will know the doctor who's there for your birth. However, you don't have to birth at a specific hospital, so the care can continue wherever you're birthing. For example, I've recently started working just a couple of days a week at Western Obstetrics, and the doctors are on call for the Western Obstetric clients at Osborne Park Hospital because that's just down the road from us. But some people will choose to have their baby at Midland or at King Eddie's or at Joondalup, and that's totally fine. That's really, really normal. We just do a little bit of shared care. So you're still going to see the hospital clinic maybe like once or twice in your pregnancy, just so they can like look at your paperwork and see you and meet you and like, answer any questions you have. Some people also go to a private hospital, and there will be a couple of appointments with a private obstetrician for that to make sure that they have admitting rights and they can get seen at the hospital when they are in labour. Shared care. So this is when a combination of care options are used to provide pregnancy care. So common combinations include care from different locations. So if you live far from your birthing place, then shared care is quite common. When I used to live and work in Northam, in the wheat belt of WA, some people would be choosing to birth at private hospitals in Perth, or would want to go to Midland or other hospitals. And a lot of the time that was because that's where their family was closest to. So they knew they'd be able to get a lot of support from their family. And so we'd do shared care between Northam at the MGP there and their doctor or their hospital clinic or wherever they were going. Shared care can also be between the initial care provider and a high-risk clinic. So you can have shared care between, so like a midwife at a pregnancy clinic and then like an obstetrician at a different hospital that you know, is a specialist in whatever risk factor has arisen in that pregnancy. Shared care can also be between midwives and doctors from different clinics, so hospital and private. Doulas. Doulas are an amazing addition to your support team. So they are trained specialists. They provide physical, emotional and educational support through your pregnancy, through your birth and through the early weeks. They're also fantastic at providing support to your partners. So I've jumped ahead of myself there. So they provide support to the birthing parent, but also the non-birthing parent. So it is really, really nice to feel like you've got a little team around you and that your partner is going to be well supported through your birth as well. They can be used in any model of care. So this is in hospital, at home, in birthing centres, wherever. And something I didn't write down is that you don't have to choose any of these models of care. There are like options out there. There are free birthing societies. These are all the mainstream options. But there also are other options. Not that I'm an expert in any of that. But if you have any questions, get in touch. So what does this mean for your birth? So when your GP asks you where you want to birth or who you want to be referred to, now you have an idea of your options. If you already know what your ideal birth looks like, work backwards on that flowchart to see who might be best suited to support that. Some care providers don't support certain pregnancy situations, things like water birth or VBAC, vaginal birth after cesarean. So ask lots and lots of questions before you commit to anyone. And then even if you've decided on a certain care pathway, you're not bound to that. You're not legally required to follow that through to the bitter end, even though you really don't want to birth or receive your pregnancy care with that person anymore. You are able to change your mind, your provider or your location of your birth at any time. Keeping in mind that if you are going private, there will be a pregnancy care charge at about 28 weeks pregnant. And that is often a significant amount of money. So if you are considering changing your healthcare professional, then just make sure you do it before you get charged. All right, let's imagine. So I've got a couple of scenarios and I just want to go through them. Please jump in if you have anything to say. I would love to hear what your thoughts are. So imagine you're a first-time mum. You're 9 weeks pregnant. You've just seen your GP, gotten bloods and a dating scan. You get asked if you have private health and you do. Okay, cool. What obstetrician do you want to see? Well, I don't know. You really want a normal birth, maybe a water birth even. It sounds pretty cool and you know that you love swimming and being in the water. You're a total water baby. You ask your GP about obstetricians that support water birth. They do not know, but they offer to send you a referral to an obstetrician that they do know. What do? Anyone brave enough to jump on? So You might choose to delay that referral to the obstetrician and decide to research how to have a water birth. You might ask people on your pregnancy Facebook group, or you might reach out to that cousin, you know, who had like all those alternative births and you're pretty sure she had a water birth once. You find in your research that not all hospitals have a bath, or even the staff that know how to support water birth, because you do have to do training for that. One of the private hospitals has a bath, and you decide to ask for a referral to an obstetrician who works there. In all this research, you also find that your local public hospital has a birth centre. They do lots of water births, and there's also a private midwife who just lives 10 minutes down the road, who can support water births too, whether it's in your house or at the birth centre. What do you choose? You can just write in the comments as well if you have any opinions. All right, we're going to jump into the next scenario. You're 8 weeks pregnant. It's baby number 3 for you. You've had a cesarean for your first baby, who was breech, let's say, and then you had a VBAC, a really normal birth after that. You feel comfortable with both births, and you've asked your GP for a referral to the local public hospital. You've had some back pain from the epidural that you had with your last birth, and just a few months ago you were in a car accident, and since then the back pain's been much worse. At your first antenatal clinic appointment, the midwife sends a physio referral for you. It kind of helps, but the pain doesn't really improve. It just stops it getting worse. You've now made it to 34 weeks, and you're starting to wonder about what birth would make the least impact on your back, especially thinking about the fact that you're going to have a new baby to look after. What do you do? A referral for an anaesthetist is sent. You see them, and they can't give you any guarantee that a repeat epidural won't cause any more damage. They do tell you that a spinal for a repeat section would probably be much nicer than an epidural and have much less risk of creating any further damage. You also start to wonder about having a birth without an epidural, and you talk to your midwife about it. They don't have a water birth option at this hospital, but there are other options. There's the gas, there's the morphine, you can jump in the shower. You know the next closest hospital has a bath for birthing, but that's 20 minutes further than your local hospital, and you really like the midwives you've gotten to know at this one. What do you do? So really complex situations in terms of lots of choices, and everyone's going to choose something different. So choosing outcomes. Remember that not everyone is going to choose the same path as you. We make our choices based on our personal preference, our environment, our finances, our beliefs and values, what we feel most comfortable with. As long as you're making the decision that suits you best and that allows you to be empowered and supported in your birth, then it's the right decision. You could ask 10 of your closest friends, and you might all make different decisions in those scenarios. And that's okay. It's allowed. So if you're trying to figure out what your ideal birth might look like, there's lots and lots of amazing resources out there. Even just jumping on Instagram and scrolling through all the birth hashtags and, you know, then going through like cesarean birth and water birth and normal birth and epidurals and like whatever you find interesting. There's some really good resources out there. These are my favorite ones. So Millie Hill is an author. She is in the UK, but the UK system is really similar to Australia, so it does translate very, very well. She has a book that came out a good few years ago now called The Positive Birth Book. That is a book that I recommend for everybody who's pregnant. I buy it for all my friends when they get pregnant. It's a really easy read. There's like an A to Z of like pain relief options, and there's like what does a cesarean mean, and it literally covers all your bases. It's very like unbiased, just this is the information, but it presents it in a way that's really easy to understand and just be able to read like little bits at a time if you're quite busy. If you jump on her website as well at the Positive Birth Movement, she also has a free download for the birth plan icons that are used in the book. So you can download them, print them out. It's only like, I think 5 pages or something. And then you can like figure out, like, these are all my options. What do I like? What do I not like? And kind of create your own little stack of birth plans. Here in WA, the main website for looking at your local options is Having a Baby, and that's a Healthy WA website. Do lots of your own research. Talk to people, talk to midwives, talk to doctors, figure out what they do and don't recommend, and how does that feel to you? If you really want a normal birth, maybe you were a support person at your best friend's birth and she had this great birth and this great team around her, and it was really hard, but like it just felt really positive in the room, and that's what you want, then you need to start considering the team that she had around her and where she birthed, and finding someone that gives you that same positive vibe as what you felt in that day. If you're like terrified of birth and you need someone that's going to be really supportive, think about who's actually going to be able to give you lots of support. Do lots of education, try find like people and businesses and different things to support you. If it doesn't feel right, it's not the right choice for you, is kind of the end result of what I want you to take away today. I am going to make that flow chart of like having a baby available as a download. So if you want that, just pop your email in the comments and I'll send that through today. And then our next session, so we're one by one going to be going through a lot of the health professionals that we've talked about today. So our next session, I've got Hayley from Best Birth Mackay in Queensland. She is a doula. She's also been a surrogate. She's had a baby for somebody else. And she set up her own business to support people in their pregnancy. So she is going to be co-presenting the next session with me, which is really exciting. We're going to be deep diving into doulas. I think we're going to be splitting the session up into one session looking at doulas for consumers, so doulas for pregnant people, what it might mean to have a doula in pregnancy, what they do, and then also looking at a separate session to discuss using doulas about doulas and healthcare professionals. So doulas can obviously be a support person anywhere, no matter where you're birthing, but aiming a session at healthcare professionals so they really understand the strengths of a doula, the things that they can and can't do, how doulas can really be this amazing tool when you're caring for somebody who's in labour. So that's next month, Wednesday, June the 1st. I'm going to pause the recording now, but if you have any questions, please hang around. I would love to chat. And then I'd also love if you could jump over to my socials pages. I always put up lots of resources, like lots of things that I find really interesting, and you also get information about all the upcoming sessions. So thank you so much for joining me today. I can figure out how to stop the recording, but that's okay. I can just edit it out at the end. Cool. How did everyone go with that? Do you have any questions, any comments, anything you'd like to know?
Hi, Holly.